So I want to introduce Dr. Mel Burchman. I've had him on before, quite a long time ago, and I felt it was time for people to learn more about what he's been learning and continuing to teach. He's gone around the world and has taught how to use light for laser and LED technology, and is very experienced, over 30 years of using the light within the dental practice, and as well now helping a lot of people with this. So at this point in time, I'm going to ask Dr. Mel Burchman to come on. He teaches GMA Laser Education, and that is a course that I highly recommend, where him and two other very knowledgeable teachers teach on how to use light and PBM, right? Light therapy, PBM, laser. It's called a whole bunch of things, isn't it, Mel?
Yes, it is. So can you hear me okay, Tom?
Yeah, you're good. So how about
Great.
we're going to turn it over to Mel at this point. He's going, Dr. Burchman, so we're going to show how light can make a difference. So you have some slides. Please bring them up.
So thank you, Tom, and thank you everybody for being on. As Tom said, I'm Dr. Burchman. I've been using lasers since 1998. I've been doing PBM for over 23 years. We use it religiously in my practice every single day. I would not do a root canal, an extraction, a surgery, or deal with the swelling or anything like that without using PBM. But even more important to a lot of you that are on, I use it every single day in my house on myself. Unfortunately, I'm 74 years old. I have biked 30 miles a day forever and ever. My knees are horrible. So before I bike, I put them on. I put it on afterwards. I use it on many other different things. And most importantly, in the past 4 years, I used it in treating my wife, Susan, who was fighting advanced pancreatic cancer. And even though she was being treated with 100% FOLFIRINOX, which is the strongest chemotherapy there is, she did not get any oral mucositis. We use it for treating her neuropathy. Same thing, she had the maximum allowable dose of radiation, and we did this for everything. So as Tom said, I am one of the co-founders of GMA Laser Education. We have spoken all over the world. As a matter of fact, we had one presentation with people from 42 different countries. So let's get on to some of the good stuff, just my conflict of interest. So now, photobiomodulation, PBM, what is this? Well, photo means it's a light, and it can either be a laser light or an LED. Bio means it's a biological effect. And modulation means it can either be stimulation or inhibition. And previously, we called this low-level laser. We called it cold laser, soft laser, phototherapy, biostimulation. But it's around us every single day in the world. Take, for instance, photosynthesis as a prime example. Sunlight comes down, it activates the chromophore chlorophyll inside the leaves, and we get the production of energy and oxygen. Well, it's also present in the human body. Rhodopsin's the light-activated pigment in our eyes, responsible for vision. We have hemoglobin and myelin, which are light-absorbing pigments in our blood and muscle. And a prime example in humans is vitamin D synthesis. How does that occur? Well, sunlight comes down and it activates the chromophore 7-dihydrocholesterol inside our skin, and this converts this to vitamin D3, or the sunshine vitamin. So how did this work? Well, when cells are stressed, nitric oxide binds to the cytochrome C oxidase in our mitochondria, and this inhibits oxygen consumption. This reduces the production of ATP. We get oxidative stress, and we get increased inflammation. So what does that look like? Well, here's a great diagram of it. So we apply our light. It penetrates through the cell membrane. goes to the mitochondria. We replace the nitric oxide off of the mitochondria. We get the production of ATP or energy and ROS, reactive oxygen species. This allows us to get gene transcription, gene stimulation. We go ahead and we get healing, we get better function, and this is all just from applying light. It's incredible how well this works. And the most amazing part behind it is this only affects damaged cells. It has absolutely no effect on the metabolism of normal cells. Now, many of us, myself included, have had babies born and they had too much bilirubin. They had neonatal jaundice. Well, how have they been treated? Since 1958, the standard of care for treating these babies is blue light phototherapy. So it's not like it's around just now, and it's been used way, way before then. But here we are, modern medicine, 1958, using blue light. It works. And this is Dr. Andre Mester, and he is the father of photobiomodulation. And in 1968, he used a 694 nanometer ruby red laser, and he wanted to see if laser light produced cancer. And interestingly, he only used it on diseased diabetic cells. And instead of producing cancer, what he found out was that he got stimulated hair growth and he got increased wound healing. Now, I want you to stare at this picture. I have seen this picture hundreds of times, and every time I look at it, it is still amazing to me. This is the first patient that went from one country to another to be treated by Dr. Mester. Now, look at this, because when I look at this, it almost looks like this has eaten through her spinal cord. This is after this lady had been treated by conventional wound care for a year in Italy. So this is not in a third world country. She was in Italy, treated for a year. She's the first person to go from one country to another. She went to Hungary. She was treated by Dr. Mester just with red light. And after 6 months of treatment, you have healing. How incredible is that? So, photobiomodulation, why should we use it? What's so great about it? Well, there's so many benefits behind it. It almost sounds too good to be true. And until you start to use it and do it, you won't believe it. But these are all true. We get increased cell respiration. We get increased cell energy production. We get increased lymphatic drainage. We get increased endorphin release, increased RNA and DNA synthesis, which gives us increased protein synthesis. And we get increased collagen synthesis, which is important in wound healing. We get a decrease in pain fiber transmission. We get a decrease of post-op pain. We stimulate the formation of capillaries, and this is tremendously, tremendously important in wound healing. We stimulate odontoblasts, osteoclasts, and fibroblasts. So therefore, we're stimulating the growth of bone and dentin and soft tissue. We stimulate nerve regeneration, and we stimulate stem cell production. Now, how do we get our pain control? Well, remember, I was just saying one of the benefits is the increased production of beta endorphins. So these endorphins will go to the binding sites, the receptor sites on the end of the neurons. They bind in here, and they prevent that pain transmission going to the next nerves. So this is one of the ways that beta endorphins will go ahead and prevent the nerve pain transmission, and they decrease pain, and by that they also decrease opioid use. So what effect does photobiomodulation therapy have on general health? Well, we increase the resilience of our cells and tissues. As I said before, we increase ATP generation. We enhance the recovery process. We increase muscle strength, muscle performance. We reduce muscle wasting and degeneration. By the way, virtually every NFL team and tremendously amounts of individual athletes all do this on themselves, Olympic athletes and so on. This really, really works. As a matter of fact, one of my dear friends and her husband's over in Australia, they do this on one of the professional rugby teams, and it was working out so well that to extend the contract, the owner of the team said that you cannot disclose what we are doing to the other teams. I want to keep this as an effect just for us. PBM also affects damaged or diseased cells and tissues, not normal ones, like we said. We activate transcription factors, gene signaling, and we decrease inflammation. So Tom asked me to talk about wound healing as one of the subjects tonight. And so with wound healing, we have three phases of it. We have the inflammatory phase, the proliferation phase, and the remodeling phase. And this is Dr. Mary Dyson, who is one of the best researchers on wound healing in the world. As a matter of fact, for those of you that are doctors and other healthcare professionals, if you've ever used Gray's Anatomy, Mary was one of the editors and contributors for there. And she goes on to say that PBM helps acute injuries heal more rapidly, decreases the duration of acute inflammation, induces healing in chronic lesions. You saw that one that we were just talking about that had a year of traditional wound care. The proliferation phase of repair begins earlier, and this is where granulation tissue is formed. Granulation tissue is scar tissue. We increase angiogenesis, and we alter the rate of wound contraction, all important things for healing. So another great researcher is Dr. Michael Hamblin, and he is at Harvard, and he was talking about how laser reduces healing time. Once again, the inflammatory process progresses more rapidly. Proliferation phase begins sooner. Wound healing process is enhanced, and tissue remodeling and healing is completed sooner. And if you look down here on the bottom, you will see the normal inflammatory response, and look how much shorter it is down below there when we apply laser. And by the way, laser, you can use laser or LED interchangeably in this, and you can see the difference in the healing time. So I'm a dentist, so this is a case where this person had this oral lesion, but not only did they have the lesion, it was very, very painful. And on the right there, you can see a nice close-up of it. So what we wound up doing first, okay, we remember, you want to control pain, you want to go over 8 joules per centimeter squared. So the first couple times to decrease his pain, we were doing an inhibitory dose. Then when he went ahead and said it was not pain and we wanted to make sure that we got healing, okay, we went to a stimulating dose. Also, when you're doing this, make sure you cover the entire area of the ulcer of the sore. You can do this on burns. You can do this on cuts. It is incredible how well this works. One day, one of my assistants came in. She had dropped a hot iron, the clothing iron, on her forearm, and you could see the entire outline of it on her hand. And I said, Jen, go into the back, take out one of the lasers and put it on there. You would not believe how much quicker it healed. One day I was doing a ton of yard work, and I have a machine for going ahead and doing my edging, and it rained the day before, so it was getting stuck, and I always know you shut it off because the last thing I'm trying to do is lose a finger or a hand. But unfortunately, I went ahead and I leaned my forearm against the hot engine, and you could hear the sizzle. My skin was cooking. And I just came inside, I put the laser onto it, and it's incredible how much faster it heals and how much quicker the pain goes away. So remember, pain control over 8, healing and stimulation under 8. And so 9 days later, look how beautiful that tissue looks, complete healing. And you will get this all the time. All the time. It just works tremendously. For any of you that are out there that are dentists, every once in a while, you'll catch your finger on a drill tip. And especially if you had already just used it on a tooth, your finger will swell up. I guarantee you, the minute you do that, you stop, you put the laser onto there, you won't get any swelling at all. Another type of sore that's really common, especially we have winter coming, what's this, in 2 days from now? So aphthous ulcers and herpetic lesions. And so we get these, they're raised, they look almost like blisters on your lips, but they are very, very sensitive. They burn, they itch, and you just want to go ahead and scratch them, but you know that you can't do that. So once again, PBM, and first you'll notice where it says lymphatics 4 joules per centimeter squared. Whenever we are trying to reduce inflammation, very important to stimulate the lymphatic glands first. Now, 4 joules, the typical dose for it, and red light. So we're going to go ahead, we're going to do our lymphatics in the area. We're going to go ahead, we're going to use our PBM. And once again, we're going to make sure we get all of our borders, cover the whole part of it. I like to do it in cycles, so I'm going to do 30 seconds on, 30 seconds off, and I'll do that 2 to 3 times. Sometimes if the patient really is like, doc, this is just killing me, I'm in so much pain here, I will do an inhibitory dose the first time. But most of the time, and I do have some patients, they get some of these are 1.5 inches, long, that they need to come back. But what we are getting from this, because when you go ahead and you do this, you're not getting a tremendous difference in the way it looks. But what you are getting is a tremendous decrease in the itching and the symptoms that you get. So if you take a look here on the left, here's our pre-op, and it's nice and bubbly all along there. The immediate post-op, yeah, the bubbles have decreased, but they're still there. You can still see them. By the way, this is a non-contact procedure. So you want to be about 1 millimeter or 2 away from the tissue, as you do on many sores, because the last thing you want to do is put a laser tip on an irritation and rub it along there. You're just going to cause more irritation. So remember, non-contact, but you're very close, only 1 millimeter or 2 away. Once again, remember to cover the entire area. Another one of the pioneers in PBM was Dr. Jan Tuner. And he wanted to demonstrate the effect of PBM on the circulatory and the lymphatic vessels. So if you take a look up here on the top left, you're going to see the artery, the vein, and the lymphatic vessels, and look how small they are. And now look down on the lower right. This is the post-op after only one treatment with PBM. So we are bringing more blood to the area, and we are removing more of the inflammatory products from the area faster. So, excuse me, so how did this work? Well, this is in a case of a 57-year-old lady who fell and she broke her tibia and fibia. She had 2 plates and 16 screws put in, and 4 days later, she's in tremendous pain. She went to a med-tech facility, that's a laser facility, and they started doing low-level laser on her. And the middle one is after only 3 treatments, and the one all the way to the right, 5 treatments over 2 weeks. That's it, 5 treatments over 2 weeks. Look at the healing in that scar tissue. By the way, you will get a much smaller scar also, but after 5 treatments, the pain is gone, the edema is gone, the tenderness is diminished. And as I said, minimal scarring. A good friend of mine had shoulder surgery done this summer, and she purchased one of Tom's lasers. She was doing it for several other things, but they could not believe when she went back for her 2-week post-op how much healing that she had in that scar area. And not just does it heal faster, but you will get a smaller scar. Now, of course, for guys that want the scars to show off and so on, you may not want to do it, but other than that, it's great. Next, we always hear about people, unfortunately, with severe diabetes having toes amputated. It'll start with the big toe, then they'll get the next toe, then they're going to take off the other ones, and then it goes to the foot, and then unfortunately, sometimes, below the knee, and then other times the whole leg. And this is one of the best uses for PBM. So here's another case. On the top left, this is the initial photo. This big toe was scheduled for amputation. Now, why do we get all of this neuropathy? And it could be either from chemotherapy or it can be from diabetes. We get this because we have a decreased blood flow to the area. What did I say one of the great benefits of PBM is? increasing blood flow, increasing lymphatic drainage. So this person did not want to get her toe amputated. She once again went to a medtech facility. By the way, this toe was treated for 3 months by traditional wound care. Well, now you can see her immediate one. And after 6 weeks, look at that difference. No longer needs an amputation. Why? We increased the blood flow to the area and it healed. This is a study that was published in Lasers in Surgery and Medicine. It's called Phototherapy Promoting Healing of Chronic Diabetic Leg Ulcers That Fail to Respond to Other Therapies. You'll see the name in red on the bottom, Dr. Kachuka, an excellent researcher, really is. So what they did is they combined 660, which is red, 890, which is infrared, as LED, and they did these together, and they had 28 cases. So they did 14 that just received traditional wound care, which was 1% silver sulfidamide cream, and they did a placebo laser therapy, which means you put the laser on, into the area so the people think they're getting it, which is great when you're trying to get a study result. So they think they're being lasered, but they're actually not. And then the other 14 got the silver sulfidamide, and they got active laser, 3 joules per centimeter squared. This was done twice a week. Now, from here, what they found, the laser group had significantly higher ulcer healing rates, faster healing by day 30. By day 90, 58.3% of the ulcers had fully healed. 75% had achieved 90 to 100% healing. Think how great that is. Now, also, you heard me say both groups received the traditional treatment. One did it with the laser. And that is another wonderful thing behind this. This is not, well, do I do laser or I do traditional? Laser works symbiotically with the traditional treatments. It could be for herpetic lesions, aphthous ulcers. Doesn't matter. It's not one or the other. Put them both together. It's the old 2 heads are better than 1. So their conclusion, combined 660 and 890 light promoted rapid granulation and healing of diabetic ulcers that had failed to respond to other forms of treatment. So let's start talking about using PBM for neuropathy and preventing of radiation skin peeling. Once again, this I did on my wife, Sue. And even though she received the maximum allowable dose of radiation, she had advanced pancreatic cancer, she got no burns. So this is a study that was done, low-level laser therapy, PBM, in the management of side effects of chemoradiation in head and neck cancer. And it talks about radiation dermatitis. And what we're getting, what are we doing? We're burning the tissue. So we have injury, we have inflammation, we have DNA injury, we have release of inflammatory cytokines, we have erythema, we have edema, we have ulceration. We've changed the way the skin is, we've changed the follicles on there, we've changed the collagen, and we damaged the elasticity of the fibers. So all of this, we need to do something to help to make sure that we don't get any problem with it. Now, you're going to see in the pictures that I have, I am wearing a shirt, and I'm also wearing a shirt that is dark. You never, ever, ever want to do this through dark clothing, okay? Ideally, the best way and the way I work on myself is I take my shirt off in the morning. So the shirt would be off. Remember, I was saying we always want to do the lymphatic vessels first. And you may say, hey, what the hell do I know about lymphatic vessels? I'm a secretary or I'm an electrician. Very easy to find out the lymphatic vessels in the area. All you got to do is go onto Google and do arm lymphatics, boom, it'll pop them all up and you'll see where they are. Same thing with any other parts of the body. So now, for finger neuropathy, finger and hand, We first are going to start with our axial lymphatics. This is in the underarm here. Then we're going to go to the brachial ones, which are right there in the elbow. Remember, red light, 4 joules per centimeter squared. Then for the hand, we're going to go to the underside of the wrist. This is called the golden triangle. It's heart 7, lungs 9, P6. These are 3 really important acupuncture points. And also, this is an area which is called the cuboidal area. And what that means in English is that this is an area where the blood vessels are close to the surface. And besides regular effects for light, we get a secondary effect. What do we mean by that? Well, we apply the light so the photons get into the blood vessels and they travel through the circulatory system throughout the body, and they help, they help remove inflammation in other parts of your body. So golden triangle, then we're going to go onto the top of the wrist, and then we're going to go all over our hands. So we're going to do the top of the hand, we're going to do our top of our fingers, then same thing, we're going to do our palm and the lower end of the fingers. Remember what we are doing. We're going lymphatics, we're going large to smaller. We are opening up the vessels, we are opening up the lymphatics so that we're getting more energy to the area, more blood and nutrients to the area, and we're removing them that much quicker because we have opened up our lymphatics. So now, other people are getting it through their legs. Same type of situation. And once again, forget the fact I got my blue sweats on. So where are we going? Once again, our lymphatics. So we're going to do our genital ones, which are just on the inside of our thigh. Then we are going to go ahead. The popliteal fossa, that is the depression behind our knee, has the main lymphatic for the lower leg, and also has something very important, a really important acupuncture point, bladder 57. So we're going to go genital, popliteal, then we're going to go on the outside of the ankle, inside of the ankle, and then same thing, we're going to go top of the foot and the toes, both on the top and on the bottom of the foot. This opens up, this makes the blood come through, makes the lymphatics take it away, and this is a great, great treatment, and it really will help you. Now, a lot of people say, how often can you do this? Well, depends how severe your neuropathy is, and if you already have a lot of it and you're dealing from a catch-up type of situation, you can do it every day. Then as you start to get under control, you can decrease it, do it every other day, then 3 times a week, and so on. Some people will do it 3 times a week for 2-3 weeks. They'll stop for a week and then start up again. Whichever way you're comfortable with when it comes to that. I like to do mine 3 times a week now that everything that I'm dealing with for the most part is under control. And so with that, I am done. Ooh, I didn't know we were going to go to there, but we did. And so, any questions anybody would like to ask?
Yeah, we'll go into questions in just a minute. I just like to do my standard commercials on.
Oh, you know what, Tom? Excuse me for 1 minute, and I'm really sorry. Hang on 1 second. So I wanted to do something in here, and I forgot to say it.
Oh, okay, go for it.
Okay. So you'll notice the laser that I'm using is Tom's laser. No. And I have nothing to do. You saw my conflict of interest. Okay, I'm not paid for today. Nope. And I have no part of the company. I love his laser. I have 8 lasers in my practice. I've probably got about 12 in my house. What is he, crazy? Whatever, once you get into this stuff, we're dentists. We buy everything in sight. This is a great, great laser. And the reason that it is so good is the head on it is very big. So the big head really, really helps because there's times when we're trying to find an acupuncture point or a trigger point, which is the point that is starting pain. And this is so big that you know you're going to get them. It's not like you're dealing with the small little one. Am I there? Am I not? The next off, take for instance, if we're dealing with TMJ, I can put it here and here. I only need to do 2 places, where if I'm doing a smaller one, I may have to go here, here, and here. So it's got a big head, which is great. And the other part, it's got really nice power behind it. So remember, I was talking about the 4 joules per centimeter squared. Remember, stimulation, 4 is the one you're typically going to use. And depending on which of Tom's units you're using, you're going to go, in the red, you're going to go from approximately 36 seconds, in the, what's that one? The palm one is the lower one?
The professional, yeah.
Right? But then when you come up to the one with the 1050, I don't remember his names, I'm sorry.
No problem.
You're going down to 30 seconds, 28 seconds. So now think about this, because people say, my sister's sister-in-law hurt her back about 4 weeks ago. My sister's got one of Tom's lasers. My brother has one of Tom's lasers. My cousin has one of Tom's lasers. No baloney, this is the truth. Anyway, so my sister brought her laser over to her sister-in-law, okay? And she was using this, and she was in terrible pain. Plus, within 3 days or 4 days, she was leaving for a week-long business conference where she was going to be standing 24/7. And so we got her really under control. We were doing her twice a day and so forth. And I'm not looking in anybody else's pockets. I have lasers in my practice cost me $80,000. Other ones cost me $60,000, 30-something thousand. These are 14 or 1,500. I forgot which. So to me, that's not a lot of money, but I understand my pocket, and I'm doing this for work, is a whole lot different than others. So my sister's brother, my sister-in-law's, my sister's sister-in-law husband says, "Oh, I'm not spending that." He goes on to eBay and he says, "You can get these for $100. Yeah, you can. Tiny little head. You got to put it on something for 15 minutes to go ahead and get 4 joules. So by the time you do this arm, you're going to be so old you don't have to worry about whether you got neuropathy anymore. You're going to be dead." So tremendous amount of advantages to this one. And now I'll let Tom do his part.
Well, thank you very much, Mel, for this wonderful set of slides and your deep knowledge in PBM. So, yeah, we've been at this for quite a while, actually. My first light goes back 15 years. Yeah, okay. The first light I developed is almost 15 years ago. And this was the size of the light that we developed, special filtering, everything like that. But we saw so many good results with that. And basically, the new developments of these devices are super light, and they have as much, if not more power, optical power, than the older units.
Hey, Tom, did you have a cell phone that matched that first light too? It's like...
Yeah, I had all the versions of cell phones all the way back. You had to extend the antenna, you had to do this, sometimes you'd have to stand on a picnic table to get reception, whatever it took. So anyways, with our lights, we have the first, the one is the professional, and it has the 660 nanometer wavelength and 810. Now the 810, you can't really see it very well, but it's because our eyes and this camera can't pick it up. But I want to show everybody something here, is that with lasers, you get more of a spot source of light. We have the optical power over the whole area really, really even. So that means that there's no hot spots with this device, and that makes it very safe as well. So this is the Palm Professional. Then the next one up we have is the Ultimate, which basically has 25% more power. And that means you can have a 25% shorter treatment time, and you may get a little bit extra depth with that, depending on the tissue you're trying to go into. And then we have our newest kit on the block, which is the Super Palm 1050. And this has the 660 nanometer, just like the Ultimate does. But we have the 1050 nanometer, which again, I can't see it at all. but you can see it in the camera. And that wavelength can looks like we're getting some really good feedback that you can, the possibility of actually penetrating a little bit deeper. There's some stuff you mentioned, Michael Hamlin, and he's done some work on 1050 nanometer and feels that there's certain things that we'll see as research continues to go forward. Why does 1050 seem to be a little bit better in certain areas? But the 1050 is really good for brain stuff. And I've done a light now which has this is our helmet, and this helmet has the two wavelengths as well. That's the one wavelength 660. So if you want to grow hair, that's a possibility if you still got some hair follicles that can do something. And this is the 810 nanometer, and you can see a little bit of the wavelength coming out of on that. But this is our helmet. It just goes up and down like one of those old hair dryers that you use, but it just nicely applies a very even amount of illumination over the whole area. This is the mini canopy, this device here, and this has the two wavelengths, 660. This is the 810 right now. You can't really see it very well, and it has the 660 nanometer as well. So as Mel pointed out, that the blood is, it's highly absorptive, the 660 nanometer in the blood. So you're making an effect on the blood, and the blood is going far further than the area you're treating. So that's our different products. So thank you for joining us tonight. Spread the word. We'd love to continue to increase the audience, and it's great to see people from around the world here tonight. Thank you.
Have a good night, Tom.
Yep.